About what mobility means to people as I'm doing this. Something like, how does it affect self-concept? How does it affect, your impression, your quality of life? Anybody have any thoughts on that? What's that?
I said it would be a huge deal. I mean, if someone's used to being able to move around and do things, and then all of a sudden they just can't perform even activities of daily living, brushing their teeth, or,
And what does it mean if you can move? You can get up in the car and go somewhere. What does that mean to your life?
you have
Freedom, yeah. You don't have to rely on someone to pick you up. You don't have to rely on someone to walk you to the bathroom. All those things are really important to your perception of yourself. One other piece of it is that as people age, they don't realize that their body isn't the same, because their brain is the same as it was 20, 30 years ago, but their body isn't. So it takes people a while to recognize that they're not as adept as they used to be. This part of them doesn't work. I got my mom a walker probably 5 years before she would use it. And she would be walking through the house like this, and she just loved the grocery cart. I don't know, I just love the grocery cart. But really, it's a walker. And so it took her a long time to recognize, because she didn't perceive herself as an old person. And so anyway, it's a big deal in terms of how you view your life, your quality of life, that kind of stuff. Okay, so we're mainly going to talk about arthritis, which is osteo or rheumatoid, osteoporosis, and trauma-type injuries. Those of you that copied out your study guide, learning guide, I reversed it a little bit here. So I moved the second half to the first half. So I think I had arthritis in the beginning last time. Do I? On the paper? Well, anyway, we're going to go to osteoporosis. But first you have to figure out how you're going to diagnose what's wrong with someone. So we've all heard of the X-ray, the MRI, the CT. So what's the difference? What's the value of each? So an X-ray, really good for a long bone, a fracture, pretty basic, straightforward things. It's not invasive, it's relatively cheap. It's the radio X-rays identify the areas of higher density. So the black line will be the fracture, the break, that kind of thing. There's a minimal risk of radiation, and pregnant women can't have X-rays. And they can do contrast with X-rays to show the movement of the blood. So they'll inject a radioactive medication, a dye, and it'll show some joints and discs. So a CT, computer tomography, is basically same technology as an X-ray, but it's slices of your body, and usually both planes. And it's like in a complex car crash, trauma, those kind of things. It's a good diagnostic tool. People have to stay still while they're getting an CT, and there are certain people that can't. And so it becomes not usable for those people. Similarly with the MRI, they have to stay still, so the picture will show up. But the MRI is magnetic resonance imaging, and there's no magnetic items allowed in the room. And before you send someone to MRI, you do a checklist to review what they have, what they, internal, implanted, insulin pump, bullets, shrapnel, those kind of things. So they're very cautious about checking this. And you'll always find someone who has something metal. They can't get their wedding ring off. They had a hip replacement. And you're like, I don't know. But usually you send that downstairs, what we do downstairs, and they say, oh no, that's fine. They are much more familiar, but you always want to make sure you identify any metal that might be a problem, because it could be a serious issue. Imagining if something in your hip got sucked down to the magnet, it would be damaging. So really, soft tissue is what MRIs do. And they're good for osteomyelitis, ligament, tendon damage, and avascular necrosis, where the blood doesn't hit the joint usually, and so the bone starts dying. So again, it's a tunnel, usually like this, and some people can't stay still, claustrophobic. We often offer meds prior to an MRI, like Ativan or something to calm people down. And there's also, just the other day we had to, I work at Good Sam. At North Albany here, they have an open MRI. So one of the nurses accompanied an ambulance all the way to North Albany, so the patient who is larger could get her MRI. And then again, insulin pumps sometimes. I don't think pacemakers and defibrillators are an issue too much anymore. I think they used to be, but I think they're okay now. And another one that we diagnose is bone scans. They're usually for bone density, like osteoporosis. They're often done as a, you get a baseline and then you watch the progression. It's very non-invasive, really simple, fast, no pain, nothing. So in a bone scan with radioisotope, they will inject radioisotopes and see what's taken up by the bone tissue. These osteomyelitis, for example, is often missed on the first diagnosis. We don't know that the infection has gotten all the way to the bone. So we sometimes do these in diagnostics progressively. Check an x-ray, can't tell. Go to a CT, we can't tell. So then we'll move on to the next thing. So osteoporosis, you've all heard of that, correct? It's the progression of bone loss, resulting in low bone mass and fragility. Osteopenia is on the way to osteoporosis. It's lower bone mass, but not quite as fragile as osteoporotic bones. It's really common. There's a lot of education and sort of publicity because the results of osteoporosis are kind of grueling. 28 million people have some degree of osteoporosis, more women than men. I read this, 1 in 3 women over age 50 and 1 in 5 men will have an osteoporotic fracture. And let's see if I put this here. Well, so here's the typical osteoporotic